Dr. Andy Galpin discusses the importance of VO2 max in predicting longevity and overall health. He explains that VO2 max is a measure of how much oxygen your body can utilize during exercise, and it is a key indicator of cardiovascular fitness. Galpin emphasizes that VO2 max is a better predictor of lifespan than traditional health markers such as cholesterol levels or blood pressure. Galpin shares research findings that show a strong correlation between VO2 max and longevity. Studies have found that individuals with higher VO2 max levels tend to live longer and have a lower risk of chronic diseases. In fact, VO2 max is a more accurate predictor of lifespan than factors like smoking history, cholesterol levels, or family history of disease. Galpin explains that VO2 max can be measured in a laboratory setting using specialized equipment. However, for those who may not have access to a lab, there are alternative methods to estimate VO2 max. These include submaximal tests like the Cooper 12-minute test or using online calculators based on activities like walking, biking, or rowing. Galpin highlights the significance of VO2 max in daily activities, especially as individuals age. He explains that a low VO2 max can lead to decreased energy levels, difficulty performing basic tasks like climbing stairs or walking, and a higher risk of functional dependence. Individuals with low VO2 max may experience fatigue, brain fog, and a decline in overall quality of life. Galpin discusses how low VO2 max can contribute to a downward spiral of health issues. He explains that individuals with low energy levels may turn to stimulants like caffeine or energy drinks to cope, leading to disrupted sleep patterns and further fatigue. This cycle can also result in poor nutritional choices, weight gain, and a lack of physical activity, exacerbating the initial energy deficiency. Galpin addresses the use of wearable technology, such as smartwatches, for monitoring VO2 max. While some devices may provide a proxy measure of VO2 max, he cautions that the accuracy of these measurements can vary. Individuals who are unable to access a lab for VO2 max testing may consider using wearable technology as a convenient alternative, especially for tracking changes in fitness levels over time. He mentions that while wearable devices like Apple Watches can provide VO2 max estimates, they may not always be accurate. He recommends relying on companies like Garmin or Polar, which specialize in heart rate monitors, for more precise measurements. He also suggests that individuals should not solely rely on VO2 max numbers for motivation, but rather focus on overall progress and improvement in fitness. When discussing benchmarking VO2 max, Galpin explains that running is the most common form of testing, followed by biking and rowing. He notes that the more muscle mass involved in the activity, the higher the VO2 max score will be. Galpin advises individuals to choose an exercise they enjoy and feel comfortable with to ensure consistency in their training. He also recommends avoiding activities that may cause injury or discomfort. Galpin provides insights into interpreting VO2 max scores based on a chart for women in their 40s. He mentions that a mid-30s score is average, while a score above 45 is considered superior. Galpin encourages individuals to aim for a VO2 max score that matches their age, such as above 50 for a 50-year-old. He emphasizes that even a modest improvement in VO2 max can have a significant impact on health and longevity. Galpin discusses various principles for improving VO2 max, emphasizing the importance of challenging the cardiovascular system consistently. He highlights that the method of exercise is less important than adherence to a training program. He encourages individuals to choose activities they enjoy and can commit to regularly. He also stresses the concept of progressive overload, where individuals gradually increase the intensity of their workouts to continue improving VO2 max. In terms of retesting VO2 max, Galpin recommends getting a test at least once a year to track progress and make informed decisions about one's health. He explains that having serial data on VO2 max over time can provide valuable insights into changes in fitness levels and overall health. He emphasizes the importance of regular testing to monitor improvements and adjust training programs accordingly.